The hypochondriasis disorder is having an overwhelming fear that you have a serious disease. The conversion disorder is a rare somatoform disorder in which a person has a specific, genuine, and physical symptoms, but there's no physiological basis for the symptoms. Some of the risk factors of having a hypochondriasis or conversion disorder is having a serious childhood illness, serious illnesses or deaths of family members or friends, difficulty in expressing emotions, a history of physical and or sexual abuse, and recent significant stress or emotional trauma.
We've all heard the phrase worried sick at some point, but for people with hypochondria, there's no saying more ironic.
The American Psychological Association claims 5% of all U.S. adults suffer from hypochondria. Hypochondria is a mental illness where a person worries and fears they're seriously ill despite all contradicting medical evaluations and assurances. Hypochondriacs misinterpret normal bodily functions or minor health issues as signs that something very serious is wrong. For example, a hypochondriac may misplace his wallet and become convinced that he's developed Alzheimer's disease, or he might be certain a standard headache is really a brain tumor. Hypochondriacs tend to exacerbate their condition by obsessively consuming medical research, frequently checking their vital signs such as temperature and heart rate, and by regularly scouring their bodies for lumps, sores, or other problems. When doctors reassure them there's nothing wrong, hypochondriacs may go doctor shopping looking for practitioners who believe them that they're sick. Hypochondriacs can get so obsessed that their work, family, and even social lives suffer. And 60% of people with this condition also suffer from another mental illness, namely major depression or an anxiety disorder. Doctors have found that a history of physical or sexual abuse may also foreshadow hypochondria. Growing up with a hypochondriac parent or having a serious illness as a child is also a factor. Whatever the cause, hypochondria is tough to treat as patients have a hard time admitting that their problems are mental, not physical. Talk therapy is the most common treatment for people seeking help. In therapy, patients learn how to change the thinking and behaviors behind their symptoms. Certain medications like Lexapro, Paxil, and other antidepressants in the selective serotonin reuptake inhibitor class are also helpful. The goal of treatment is not to cure hypochondria, but help the patient live as normally as possible, even if symptoms continue. If you or a loved one seems to suffer from hypochondria, make an appointment to see a mental health professional.